So we are not fully staffed by any stretch of the imagination. We have multiple vacancies in all job types, people leaving because they can get more money working as a traveler. The other thing is we did see a high number of retirements. I think the other thing is our staff, especially our positions such as environmental services, dietary, nursing assistants, transporters. We're in registration staff, phlebotomists. We're competing now with non-healthcare organizations that we never had to in the past. So now we compete on the hourly rate increases against Target, Walmart, Starbucks, which has created even a bigger divide in those other areas that we typically didn't have as much trouble. Working with our director of case management and our chief medical officer, they've teamed up together to redesign and relaunch our peer supporting peers program, specifically focused on the high level clinicians right now, which is our physicians and our nurses and like physical therapists and so forth. Working with, as a matter of fact, the Betsy Lehman Center. I did work with Linda Kenny. We did some focus groups here with our environmental services, dietary, nursing assistant, and transport staff, looking at it from a cultural perspective and looking at it from a language, ethnicity, race perspective. So what we did was we brought in an interpreter and we did set up different groups of Spanish and Portuguese speaking and put them together and had them go through a series of questions of what do they define support as. So for us to develop a peer supporting peers program, we wanted it to be culturally sensitive to their needs versus just a blanket high level clinician need. But during the middle of COVID, so the Joint Commission came back on April 5th to do their triennial survey. And one of the surveyors made a comment about the fact that in our PI book, we had a section on the safety culture survey, and we had done a modified pulse safety culture survey in the middle of COVID. And they said, well, you're awfully brave doing it in the middle of this. But our response was, well, we need to know where they're at. And some of those questions also overlap into engagement. So we're able to get an idea of where are we and how far off did we fall or go up based on where do our staff think they are in the middle of a crisis situation such as this, which has never been seen by this group, by any of us in our lifetime. So it actually was very helpful. One of the things that we did learn is a lot of points went down, a lot of the scores in the domains. However, one of the scores that went up slightly, which was kind of surprising, was the fear of reporting was better than it had ever been. It was not that they had a fear and didn't want to report. There was more reporting than we expected. So from a staff engagement standpoint, we saw that as positive, meaning they're willing to tell us if they're seeing something versus they're so stressed out and busy they can't tell us. Yes, we are challenged with staffing. Yes, we're challenged with the pandemic that doesn't seem to want to end. And how do you go back to becoming more normalized to it? Although we'll never go back to what it was in 2019. But how do we re-normalize ourselves? And I think hearing what people can do to help their staff is going to be very helpful to all of us.